What happened at this Times Square subway stop is New Yorkers' worst nightmare. But the story of Michelle Go's death began long before she was pushed in front of that oncoming train. It began when the man who pushed her tried and failed to get the mental health help that he needed. Now Michelle's family is working with Congress to try and change all of that. And unlike many efforts that flow through our nation's capital, this one actually has a pretty good chance of succeeding.
If this had been in place in 2021, that perhaps Michelle might still be alive with us.
Strong words from Justin Go, father of Michelle Alyssa Go, as he puts his daughter's name on a piece of legislation designed to drastically increase the number of mental health beds across the country. Go says the decision to advocate on behalf of people like Marshall Simon, who killed his daughter, is what Michelle, who often volunteered to help homeless individuals, would have wanted.
He was someone who should not have been there. He should have been in a mental facility getting help. I know his sister said that they ran out of money. And it's sad to think that someone like that is on the street.
Our mental health crisis is growing.
Congressman Dan Goldman, a Democrat who represents Lower Manhattan and Brooklyn, worked with the Go family and advocates to craft the legislation. Essentially, under an arcane federal law, Medicaid cannot pay for long-term mental health stays for someone under the age of 65 in facilities with more than 16 psychiatric beds.
This bill will dramatically increase the opportunity for those who want mental health treatment to get it, and it will hopefully help to solve some of our rise in homelessness and some of our public safety issues around the city.
It does this by expanding Medicaid coverage to psychiatric facilities with up to 36 beds. And the bill has broad support, including from Brooklyn and Staten Island Republican Congresswoman Nicole Malliotakis.
The U.S. is ready for people to vote and pursue something that is bipartisan. I think that bringing more safety to people in the city of New York and elsewhere, and helping people who need the help of a mental care facility can only bring good things to the country and to the cities.
The congressman tells me he has high hopes the Michelle Go Act will pass by the end of the year, probably after the election during the lame duck session. In Times Square, Henry Rossoff, Pix 11 News.